Hello everyone, my name is Michelle Kern. I am a PhD student at Kent State University in our cardiodynamics laboratory, and today I'm going to be presenting on the effects of acute resistance exercise on left ventricular function and arterial stiffness, examining the sex differences. Previous research has demonstrated an increase in left ventricular workload and arterial stiffness in resistance-trained men. However, data are lacking in women. There's currently no present data comparing sex differences and the effects of acute resistance exercise using weight machines on left ventricular function and arterial stiffness. The purpose of our study was to seek out the differences between men and women on left ventricular workload and arterial stiffness following an acute resistance exercise with weight machines. We hypothesized that both sexes would demonstrate an increase in left ventricular workload and arterial stiffness after an acute bout of resistance exercise, but with women having less of an increase in these variables than men. For this study, we had recruited 21 participants, with 10 being men, 11 being women, with the mean age of 23 plus or minus 3 years. All were healthy and resistance-trained individuals for at least 1 year via a health questionnaire. Women were also tested in the early to mid-follicular phase of their menstrual cycle in order to normalize hormonal levels. There were 2 randomized conditions. One was the control group, one was the acute resistance exercise with weight machines, which consisted of 3 sets of 10 at 75% of the individual's 1 rep max on the weight machine exercises, which included chest press, leg press, lat pull down, leg extension, leg curl. In between all sets and all exercises, 2 minutes of rest were given. Measurements taken included brachial blood pressure, heart rate, and pulse wave velocity. Pulse wave velocity is measured using Applanation tonometry, as shown here in Figure A. Figure B then depicts understanding pulse wave velocity. So over to the right of Figure B, you will see the ascending aorta and descending aorta. Pulse wave velocity is measured with the Applanation tonometry at the common carotid. For each heartbeat, there will be a forward traveling wave as well as a backward traveling wave from the bifurcation, and it is able to measure the the 2 time points. From there, you can calculate the change in time as well as the change in distance, which is done prior to performing the Applanation tonometry. So prior to any of our subjects coming in, we are taking measurements from their carotid artery to the suprasternal notch, from the suprasternal notch to the femoral artery, and from the carotid to the femoral artery. So results, we ran a 2x2x2 3-way repeated measures ANOVA, used to examine the effects of sex across repeated measures of condition and time. While sexes were the same age, men were significantly taller and weighed more than women. They also had a significantly greater 1 rep max, as well as a greater total volume lifted. And there were no significant 3-way interactions. There were significant differences seen for heart rate, subendocardial viability ratio, as well as wasted left ventricular energy. Heart rate increased from rest during recovery. Subendocardial viability ratio, which basically measures myocardial perfusion, decreased from rest to recovery. And wasted left ventricular energy, which measures the workload of the heart, increased from rest to recovery. So both men and women responded similarly to an acute bout of resistance exercise using weight machines. This demonstrates that both men and women have an increase in left ventricular workload and arterial stiffness following an acute bout of resistance exercise using weight machines. Limitations to this research include not controlling for Valsalva, limited to this specific population, as well as only using weight machines. Future research may include resistance-trained versus aerobically trained, other populations, as well as other exercise modalities. Take-home message is that both men and women demonstrate an increase in left ventricular workload and arterial stiffness following an acute bout of resistance exercise with weight machines. This may increase an individual's likelihood for a cardiac event following resistance exercise. Here, the reference page, and then if anyone has any questions, I can take them now. Thank you.